Go.
Okay, so I've checked the provider's orders for the tracheostomy care, and I'm going to be entering the patient's room. Knock, knock, knock. Hi, Mr. Smith. I'm Courtney. I'm going to be your student nurse today. We're going to be going ahead and suctioning your trach. I've gotten my supplies. Okay, can you go ahead and verify your full name and date of birth? Okay, thank you so much. And do you have any allergies, Mr. Smith? All right, thank you. Okay, I'm going to go wash my hands. And I'm going to put on some gloves. So all we're going to be doing today is suctioning out your airway so that you can breathe a little bit better, okay? All right, first I'm going to raise your bed up to a working height. And I'm going to go ahead and turn up your oxygen while we get all set up, okay? I'm going to hyperoxygenate him for about a minute. Okay, then I'm going to turn my suction on to between 80 and 120. Make sure that's fastened. And make sure that the suction is on, which it is. Okay, so I'm going to place this right here so it's easier to get to. And get my little tape. Mr. Smith, before we get started, I'm just going to go ahead and put this towel on you so that we don't get any wetness on your gown or anything, okay? Let me get these gloves off and get started. I'm going to wash my hands one more time and get ready to do the sterile portion of the procedure. Sealing. I am going to open my sterile pit away from me. Get my little basin out. I'm going to set up. Then I'm going to go ahead and whip saline and pour it in there. Alright, now we're going to open this up. Get my sterile gloves on. Another one. My sterile gloves are on. I'm going to go ahead and get my sterile tubing out of the packet. And at this time, I'm going to hook up the suction, and that is going to go ahead and then create, make my non-dominant hand unsterile. So I have to use this hand. I'm going to grab the end of my suctioning tubing that I checked earlier. And I am going to plug this into it, making sure to maintain sterility on my dominant hand. So now that it's plugged in, I'm going to go ahead and check the suction. Okay. Then, Mr. Smith, we're going to go ahead and suction out your trach. Okay. So before we do that, we're going to just check and make sure the suction works in the saline to clear it out a little bit. So we're going to stick the end of there in our sterile saline. Okay, it's working just fine. So we're gonna bring it over here. We're gonna move the oxygen to the side with our non-sterile hand and insert this. Okay. And insert it till you feel resistance. Pull it back a centimeter. Okay, and suction all the way out. Okay. Then I'm going to replace his oxygen and clear it out with my saline. Okay, which is fine. And we're going to go back for a second pass. Move the oxygen to the side. Insert till we meet resistance. Pull back and all the way out. Replace the oxygen. And clean again. Now he's good, he doesn't need another pass, but if he did, we would just go ahead and repeat that. So now that we've finished that portion, we're going to go ahead and disconnect our suction and fold it up into the gloved hand. So we're not sterile anymore. So we're going to go ahead and turn his oxygen back down to a normal level. Okay, I'm going to turn off my suction and put this up. Now I'm going to take off my gloves, making sure to keep the tubing inside my gloved hand. I'm going to take off the other one. Okay, we're going to throw those away. And then we're just going to clean up the supplies and make Mr. Smith comfortable. So take that towel away and get rid of all of this. Okay. After we've cleaned that up, we can just get it all into the trash. And then we're going to go ahead and lower his bed back down. He wants to remain a little bit upright, so we're going to let him do that. Make sure he's got his call bell. All right, Mr. Smith, I'll be back to check on you in just a little bit, okay? Make sure he's good. All right, now I'm going to go ahead and wash my hands and document my procedure and my patient's reactions.